Welcome. I'm Professor Khalid Khan. I'm based at the University of Granada. And with me, I have my colleague, Dr. Naomi. Naomi, please, can you introduce yourself?
Yes, of course. Hi, I'm Naomi Cano, a professor at the Department of Preventive Medicine and Public Health at the University of Granada.
Okay, thank you. Today, we are going to talk about patient and public engagement. And another term used for this is called citizen science or patient and public involvement. And the key point about this is that the October revision of the Declaration of Helsinki has advised that health research must include community engagement or patient and public engagement. And what do we mean by this? What we mean is that the citizen community should take part in research projects in their role as co-investigators, not only as subjects of research. So to take this forward in our video, I'd like Naomi, if you won't mind setting the scene. Can you say what topic you have selected to cover this area?
Chronic disease, for example, Khalid. Chronic disease are the main causes of living, mortality, and morbidity worldwide, and their financial burden is growing up.
Okay, so obviously this problem need to be solved through research for evidence-based medicine, uh, and here randomized trials are at the top of the evidence hierarchy. What we are going to see now is that many of the published trials have, in fact, negative findings when it comes to lifestyle interventions for management of chronic disease. Why is this, Naomi?
Well, first, I think that we should explain what is a randomized control trial. In a randomized control trial, we have two allocation groups, usually treatment or intervention group and control group. Both groups are followed up throughout the time, and after that, we compare the results between them. We have three key steps. The first one is the recruitment, the second one is the adherence, and finally is the retention in order to achieve the results that researchers want to obtain.
Okay, so now if we look at this more closely, in the treatment group, we will advise people to follow a particular lifestyle recommendation. And in the control group, we will ask them to continue their life as usual. The idea would be that the lifestyle intervention will hopefully control the chronic condition or disease better than their standard way of life. So let's take an example. If we recommend to people that they should follow a particular regime for exercise daily, but they don't follow this regime in the treatment group, and relative to the control group, their exercise level is actually not increased. In this situation, the activity level of both the treatment and the control group will be the same. In this situation, we will expect trials to show null results. By that, what I mean is that we will not be able to show that intervention is effective simply because in the treatment group, the intervention recommended has not been followed sufficiently by the participants. So, taking this forward, how can patient engagement, patient and public engagement, help in research? Can you make some comment about this, Naomi?
Yes, for participants, there are some challenges that researchers that have taken into account. The first one is the patient information sheet. The second one is the perception of allocation group, and probably unrealistic expectations. These steps can be affected in the long follow-up in order that participants doesn't adherence or hasn't adherence to the protocol of the study.
Okay, so in reality, when people are participating, they are agreeing to be subjects of the study. They actually have a responsibility to fulfill.
Yeah.
And if they don't understand the responsibility, uh, perhaps they fail to fulfill their responsibility, for example, to adhere to the recommendation given for change in their lifestyle. Also, they may not completely follow up during the course of the study until the outcome is collected, in which case their participation cannot contribute to the results. So, returning back to patient and public engagement, we need citizens represented in the investigator group so that this group can ensure that the study is well understood by the participants before they sign up to take part, and they need to remain engaged with the investigators as their co-investigators throughout the study. And in this regard, we have written an article that proposes what the curriculum should be to educate both researchers and citizen participants for ensuring that patient and public involvement can take place in research. Moving on from here, what are the key steps in involving patients as co-researchers, Naomi? Here we already have some recommendations concerning how to report the involvement of participants in research. And I've already alluded to the recommendation by the update of the Helsinki Declaration that this is an essential, not an optional element in health research. What can be done from here onwards?
Well, as you mentioned previously, we have 5 key steps that we have taken into account. The first one is knowing the expective, the demands, the needs that the patient has. The second one is creating community advisory boards, for example, through patient associations. The third one is reviewing intervention together, ensuring that the strategies, protocol, intervention accurate the demands of the participants. The fourth one is empowering patients that are part or taking part of the studies. And the final step is to a collaborative analysis. For example, with policymakers, in order to assess the impact of the economic study in the community.
Okay, so when interventions are found to be effective, citizen engagement can help transfer the findings into practice. But that is not the only step. The most important is to be engaged right from the beginning, that the topics of importance to society are given approval, and that these topics are then evaluated through research. So, the key barriers in this regard, in fact, have the potential, if these barriers materialize, to make research less useful. The idea is to maximize usefulness of research through patient participation. We have seen in an evaluation of trials of lifestyle interventions concerning obesity and overweight that most of these trials have very limited potential to be useful for society. This ought to change in the future. So, Naomi, I, and other colleagues, we have an opportunity to evaluate how patient engagement can contribute to make research more useful. And I'll ask Naomi to explain further how this study took place.
Yeah, of course. We perform a systematic review about randomized control trial that include information about patients with metabolic syndrome, obesity, and overweight, in order to recollect or capture the intervention regarding lifestyle modification, for example, diet or physical activity. We collected 26 randomized control trial, and 70 included PPI in their design.
Okay, so we'll look at the results shortly, how PPI or patient engagement made a difference to the trial. But here we can see that the included trials mainly came from high-income country setting. The number of people taking part ranged from 30 to over 3,500. The duration of follow-up varied from a month to 2 years. And the key features, when people were approached to take part in one extreme, nearly 90% of the people did not engage, whereas in the other, all of them engaged. And then in retention with respect to complete follow-up until the end of the study, in one extreme, all the people gave the outcome data, whereas in the other, only around 60% followed up completely. So let's see if engagement of community in the investigation or research in their role as co-investigator made any difference. Naomi, would you kindly explain the findings?
Yes, as you can see in the figure, we didn't find any significant difference between studies that incorporate PPI regarding enrollment rates. However, we found that a randomized control trial that include PPI has a slightly higher retention rates than those that not incorporate it. So in conclusion, PPI improves the retention rates in randomized control clinical trials in order to improve the lifestyle of people.
Yeah, this is a very important finding, as we noticed earlier, that if we lose patients during the course of the trial, we lose data, and the effort made to encourage people to take part is lost as a result. So we see here through an empirical research that patient engagement or community engagement made a dramatic difference to whether retention of participants until the end of the study was complete or not. Well, with this, we bring this video to an end. And I thank Naomi for taking part. Thank you very much.
Thank you.